join us. All right. Well, hello, everybody. My name is Fabian Mendez, and I am a program director at Conservation Nebraska. I wanted to thank you all for coming to this program focusing on contaminants in Nebraska's drinking water. It will outline what common contaminants can be found in our drinking water, how they get there, and what you can do for your health and ways to avoid them. Just a few reminders for everyone. Those of you who are online will have their cameras off and microphones muted, so you can't be seen or heard. Any questions you may have can be put into the Q&A section towards the bottom of your screen, and we will do our best to answer them at the end of the presentation. Additionally, this webinar is being recorded, so if you miss anything or wish to watch it again, you will be able to find it in a few weeks posted on Conservation Nebraska's YouTube channel. Lastly, there will be a short poll towards the end of the webinar. If you could please fill out the poll before you leave, we'd greatly appreciate it as it helps us hold and improve future events. With that being said, allow me to introduce our speaker, Laura Nagensat. Laura is a source water protection extension educator at the University of Nebraska-Lincoln School of Natural Resources. She holds a bachelor's in anthropology from the University of Michigan and a master's of public health in administration and policy from UNMC. Laura collaborates with the Water Climate and Health Program to increase awareness and education on water quality issues in Nebraska and their impact on human health. She works to serve as the link between science and the community's understanding of health impacts related to consumption of contaminated water. Laura is interested in community engagement, outreach, education, and public health advocacy. Now that the introductions are done, I'll let Laura take it over.
Hi, yeah, thank you all so much for being here today. Thanks, Conservation Nebraska, for having me. I really appreciate you guys taking time out of your evening to be here. So as Fabian said, my name is Laura Negengast, and I am the Source Water Protection Extension Educator out of the University of Nebraska-Lincoln. Additionally, I work for the University of Nebraska Medical Center and also the Department of Environment and Energy. So kind of for those three entities, I have responsibilities. So tonight, I'm going to talk to you guys about the importance of knowing what's in your water and how knowing what's in your water can impact your health. Okay, so I'm going to start off by just describing what is public health, because public health has a direct relationship with water and your drinking water. So at its core, public health is a science and art of preventing disease, prolonging life, and promoting health. So how can we keep people from getting sick? How can we keep people living healthy lives? And how can we get people to want to make healthy choices and promote their health and put that at the forefront of their choices that they make? So we do this multiple ways, most of the time through various organized efforts from different organizations like Conservation Nebraska, also specific individuals or communities that take ownership. But these are the main ways that we promote public health. Another way to describe public health is comparing it to healthcare. So the healthcare industry is focused on treating people who are currently sick, while public health aims to prevent people from getting sick in the first place. So this diagram does a nice job of describing public health. So let's say, I don't know if you guys can see my pointer on the screen, but the healthcare industry is focused on someone is falling into the river. Okay, what are we going to do to get them out, get them on their feet, treat them, get them well again? While public health is focused on the person upstream. So how can we prevent people in general from falling into the water? We don't focus on the current person sick, like healthcare. It's more of a population solution. So should we put up a barrier? How can we get people to, not fall into the river? So healthcare is focused on an individual patient, while public health is focused on an entire population. So when we think about public health, we often think about probably the COVID pandemic or some type of disease outbreak like Ebola, or maybe the flu's going around or something like that. And rightly so, that's common. People talk about that a lot. The pandemic was a huge hit our lives in such a significant way in the past few years. But public health is actually much, much more than that. And one of the sectors, and the sector that I focus on, is our environment and how that impacts our health. And it has probably a larger impact on your health than you may think. So the World Health Organization, they did a study in 2016, and they found that 1 in 4 deaths worldwide could be attributed to your environment. So whether that is the air you breathe or the chemicals you're exposed to, maybe in your home or in your water or where you work, perhaps the water you drink is contaminated. Any of that stuff has a link to your health and can either negatively or positively impact that. And so the first step is knowing and being aware, because once you're aware of what's in your air or what's in your water or what are you breathing in at work, you can try to modify your environment to improve it. So let's use an example of let's say you live in an area where there is really poor air quality, where the air is really polluted, perhaps like in a really big city or something, and you have asthma. Once you're aware that your air is polluted and you live in that area, what are the next steps I could take? Is it to the point where I need to move? Should I carry around an inhaler with me? What steps can I take to prevent an asthma attack or something that could, some type of adverse health impact? And we're going to talk about that in the context of water. So potentially we live in a place where we have contaminated water. All right, that's a fact. What can we do? What steps can we take to improve our health or prevent some of those adverse health impacts? So let's get into Nebraska's water. So 85% of drinking water is sourced from groundwater in Nebraska. So that's both public water systems and private water systems. So typically, most of the time, you drink from groundwater or surface water. So groundwater is typically, it can be from different sources, but a lot of the times it's from something called an aquifer, which is pretty much like a large body of water underground. And Nebraska has a really big aquifer underneath of it, if you are unaware. It's called the Ogallala Aquifer or the High Plains Aquifer. And so we get a lot of our drinking water from the aquifer. Some of us in Nebraska, we get our water from like the Missouri or a river or lake, but the majority of us get it from the ground. 80% of us in Nebraska drink from a community public water system. So that means folks who live within city limits, they drink from water that is provided to them by the city from a public system. 20% of us Nebraskans drink from private domestic wells. So that's like if you live out in the country on your own farm, outside of city limits, you have your own well that you use to pump groundwater for your drinking. And that's nearly 100% of rural residents. So groundwater has the potential to be contaminated, and there are two forms of contamination. There's something called point source contamination and non-point source contamination. So point source are pollutants that are discharged from a single and identifiable source. So if we're looking at this graphic, you can see the point sources. So the factory and the water treatment plant are examples of point sources. So it's like you have a pipe or something that is directly pumping pollutants into the water, and you can see it and you can find it. And that is that's different than the non-point source, but sticking with the point source. The primary point source dischargers are factories, sewage treatment plants, wastewater treatment plants, and there is an act against it. It's against the law for these big treatment plants or whoever to directly pump pollutants into the water. So you can trace it back. The point source is you can trace the pollutants, where the source of the pollutants is coming from. It's against the law, and they have to fix polluting the water from that point. That's different than non-point source contamination. So this is more complex and it's harder to treat, and there is not a specific act against it just because it's so difficult to treat. And this generally results from land runoff, precipitation, or drainage. So if there's storms, rain, a lot of irrigation going on. So let's say a bunch of water, maybe it's a heavy rain, or you're irrigating heavily and there's a lot of water moving and it's picking up different pollutants. So maybe some are natural, maybe some are fertilizers, and it deposits them into lakes or rivers that you potentially drink from, or it seeps into the groundwater, which we pump our water from in Nebraska. And so that's non-point source. It's when you don't really know exactly where it's coming from. It's coming from a lot of different areas. This could also be seen like in a city. So if it's maybe better for you to visualize it in that way, let's say there's a big storm in the city and there's just a bunch of like trash and different things running through the streets, getting into the drains. You can't really point it out to a specific area. It's just like a lot of things coming together at once that's getting into the groundwater and getting into the waterways. So it's harder to fix, it's more complex. And that's what we call most of the time when we're that non-point source pollution is what we refer to as when we're talking about fertilizer pesticide pollution, because it's harder to point back to like a specific thing polluting. But there's also other non-point source pollutions like oil, grease, chemicals in cities and so on. So different factors that influence groundwater contamination. So like I said, heavy rainfall, irrigation, fertilizer and pesticide application, the depth of the water table and well. So if your water table is a lot deeper and the well has to be put down a lot deeper, the groundwater and has to travel a lot further, and the pollutants have to travel a lot further through the soil and the vadose zone to get to that water table. So it's more difficult for the pollutants to reach all the way down to that water table and well. Additionally, the soil type has a big influence too on the ease of contamination to the groundwater. So this diagram shows that like sandier or rocky soil is a lot more permeable compared to clay. So if the soil is super thick, the water can't move through it as easily. The water with contaminants can't move through it as easily compared to a soil type that is more sandier. So you have probably, and maybe not, I guess, but there's a lot of conversation going on around nitrate. You've maybe heard this conversation or heard people asking or talking about it or seen it in the news. It is a big contaminant of concern here in Nebraska. It's been very popular, hot topic, so to say. And why is that? Well, a lot of it is because of the data and science we have regarding the health impacts of consuming water that has nitrate in it. And we have some water in Nebraska that has nitrate in it because of multiple things, but one of the main reasons is because we have nitrogen fertilizers used in row crop agriculture. And we have a lot of corn in row crop agriculture being grown here because we're a corn state, an agricultural state. And so of course we want to use nitrogen fertilizers to get high yields of our corn and make sure they're being strong and healthy. And but it's just a fact that some of it is getting into our groundwater. Some of that fertilizer that we're using is getting into our groundwater. So areas with agricultural areas are at a high risk for nitrate and groundwater contamination because those fertilizers are being used. And private well owners are at major risk for major risk for drinking contaminated water because of the proximity to farms, and there's also no required testing and treatment of private wells, which I'll get into in a little bit. But here's a map of nitrate levels across Nebraska. So these are samples that were collected in over 20 years, almost 20,000 samples. So you can see the red and the orange ones are samples that had the high elevated levels of nitrate. So you can see a lot in Northeast Nebraska, and then along the Platte River Valley, there are some pretty high levels of nitrate. So we do have some nitrate issues in Nebraska going on. So drinking water regulations. So currently the regulatory limit for nitrate is 10 milligrams per liter. So what this means is that if the water that you're drinking within city limits is above 10 milligrams per liter, the city is required to treat it. They have to bring it lower than 10 milligrams per liter. This limit was set in direct relationship with a health outcome called methemoglobinemia or blue baby syndrome. So what this is, or was, I guess, was this doctor named Hunter Comley in 1945. He was actually a doctor from Iowa. He was seeing these mothers bring in their infants that were experiencing methemoglobinemia, which is a blood oxygen transport delivery issue. So the baby can't transfer or transport blood oxygen correctly, and so it can turn blue. It can be a fatal outcome. But he was realizing, he kind of put all the dots together and realized that these women who were bringing in their infants were using formula. All the babies were drinking formula, and all the formula was being mixed with water of a high nitrate level, really high nitrate levels. And so this was in 1945. And so with more research in 1975, I think it was around 1975, they set this regulatory limit of 10 milligrams per liter was the limit to stop methemoglobinemia, to prevent methemoglobinemia from happening. But I want to emphasize that this is only for public water systems. So if you live in the country and you have your own well, it is up to you to test and treat your water yourself. They're not monitored. There's no regulation around that. So public health or public water systems are currently the ones that are tested and treated and kept under the 10 parts or 10 milligrams per liter. So now let's get into the health impacts a little bit. So as I just mentioned, the 10 milligrams per liter was set directly for blue baby syndrome, but there have been continued studies looking at the relationship between drinking nitrate contaminated water and human health since then. And drinking water with high nitrate has been linked to other adverse health outcomes, even some below the legal limit of 10 milligrams per liter. And the strongest linked are blue baby syndrome, pediatric brain tumors, thyroid disease, colorectal cancer, miscarriages, and birth defects. So I'll get into those a little bit more. So as for the adults, minor health ailments are increased heart rate, nausea, headaches, abdominal cramps. Cancers that are potentially associated are colorectal cancer, thyroid disease, kidney cancer, bladder cancer, and non-Hodgkin's lymphoma. And then maternal fetal health issues. Research has seen the relationship between miscarriages, preterm births, fetal growth restrictions, and birth defects. And then potentially research is just being started or in the early stages of looking at Alzheimer's, diabetes, and Parkinson's disease relationship with drinking nitrate contaminated water. And I want to mention that the research that I'm presenting right here is it's a very general overview. It's very broad. There aren't any statistics and super hard data. But if you guys, whoever wants me to point them to these studies, I'm more than happy to offer them to you if you want more details about all of these different types of cancer studies. So going off the maternal fetal health issues, we're going to look at birth defects in Nebraska. So national average of birth defects is 3.3% of all live births. And the average in Nebraska is 5.8%. So almost double the national average. And you can see by this map, so the darker purples are the counties with higher birth defects. Like the dark purples are really high. So some counties in Nebraska reach 9 to 12% of all live births have birth defects. So almost quadruple the national average. In counties with higher birth defects had a greater prevalence of agrochemicals in water. So looking at water that had multiple agrochemicals in it. And they found the strongest association when the water had both nitrate and atrazine in the water. They found the strongest association with a birth defect. So this was done by some folks from the University of Nebraska and other collaborators. So focusing on health issues in children research. So as I mentioned multiple times, the methemoglobinemia or blue baby syndrome has been identified, but we're also seeing relationships between pediatric brain cancers and non-Hodgkin's lymphoma. So I'm going to focus on the pediatric cancer for the next little bit. So Nebraska ranks the 7th highest incidence, has the 7th highest rate of childhood cancer in the entire US. So as you can see, we're right here in the middle. We are a dark blue state. And so the average is 173.7 and we are 183.2. So we have a high statewide incidence. We have the highest rate of pediatric cancer in the Midwest. So in the Midwest, similar to the national average, the Midwest average is 172.9. Again, Nebraska is high on that. We're 183.2. So we're seeing really high rates of pediatric cancer in Nebraska. So we break it out a little bit more by county. So as I said, we have a high statewide incidence in general compared to everyone else in the US, but these orange and red are counties that exceed our statewide incidence. So they have even higher rates of pediatric cancer. So looking at all different types of pediatric cancer is a top map. So you could see it's kind of spread out. It's not necessarily just in one area. We see some in the Northeast, but there's red counties throughout, red and orange spread throughout. So the bottom graph is looking at just pediatric brain tumors. And so again, the orange and red are rates that are above our statewide incidence. And the gray, I guess I didn't mention, the gray counties are counties that don't have enough or don't have any cases to report an incidence level. So the red and orange are definitely more concentrated in the eastern part of the state when we are looking specifically at the pediatric brain tumors. Whoops. Okay. And so folks at the Med Center and children's and different collaborators here in Nebraska wanted to look at this data by watershed instead of county. Since counties are more political, their political makeups, let's look at things from a water point of view. So the A graph is looking at central nervous system tumors. So that would be like a pediatric brain cancer. The B is looking at leukemia. And then C is looking at lymphoma. And then D is a map displaying the land use. So we can see in the eastern part of the state that there is a lot of green, a lot of corn being grown, and then the pink is small grains. But going back to these first three, so A, B, and C, the pink or like the salmon color are watersheds that have above the national average incidence level of that specific cancer. And then the green or mint color, I guess, are watersheds below the national average. So again, if we're looking at A and we're looking at the central nervous system tumors or the pediatric brain cancers, things going on, there we see a lot of it concentrated over in the eastern part of the state. And you can potentially see some type of correlation between D, so the land use of corn, and the pediatric central nervous system tumors. The B and C, so leukemia and lymphoma, it's less of a, potentially there's less of a correlation. It's more spread out or sparse compared to A and D. And I do want to emphasize in this graph that we do not, I'm not saying that this is a causation, that corn or this, growing corn is causing central nervous system tumors. That's not what I'm saying. But I am pointing this out that potentially there is some relationship with our agricultural practices and then the types of cancer or the health impacts that we're seeing. But we're not at the point with the data or the science to say any form of causation. So because of this data, these are our most vulnerable population: pregnant women and their fetuses, young infants under 6 months of age, children with the pediatric brain cancers, and then individual was with oxygen transport issues like lung disease and sepsis. That is based on the data and science that we have. I also want to mention, I guess I didn't mention it earlier on, that Nebraska is doing a lot of this work at the Med Center and so on, but understanding nitrate and some of the data and the studies that I've pulled from for this presentation it's being done across the world. It's being done on the West Coast, the East Coast, it's being done in the Netherlands. A lot of different people are looking at these associations. So some of the outreach that we're doing right now, I'm going to just go through this quickly because I want to talk about some other contaminants too. Some of the outreach, outreach is a big focus of this water and health work that the Med Center is doing, that folks in this sector are doing, is to getting people to understand what's in our water, what's going on. So we have a lot of different educational resources that we're developing. There's videos, we have websites, infographics in different languages. I also really try to emphasize peer-to-peer learning. So I am not an expert in farming or agriculture. That's not my background. But I try to bring together different people who are. So, for example, this was an event we held in York. This guy in the white is a farmer, and he was talking to other farmers or people interested in agriculture about some of his practices. This is also where I'm creating some continuing education credits for healthcare providers and also childcare providers. We're creating some water quality curriculum. Looking ahead, so work that we're going to continue doing is expanding our audience. So we know that women make 80% of the healthcare decisions for families in the US. So really trying to reach that population is really important for us. Working with public health departments, that is, we're just beginning to do that. And then youth, also always looking at more research and funding, outreach opportunities and collaboration. All right, and I'm going to finish up by a few other contaminants. So you may have heard of PFAS. This is a common topic of conversation, I guess, at least in my world, in the water world. It's a substance that's found in a lot of things. A lot of I mean, the most common is like firefighting foam, but it also can be found in like nonstick pans and all different kinds of things. And I can answer questions about this if people are more interested too. But we are seeing health impacts related to that. There's potentially a new maximum contaminant level that community water systems are going to have to follow regarding PFAS because of the data associated with the health outcomes. So I'm not going to read off the list, but there are significant health outcomes, and I think there are significant. There's a lot of data, I guess, supporting that these health outcomes are related, especially PFAS at a high level. We've all probably all consumed or PFAS in some way or another, is what the data is kind of showing, but it's really at it becomes an issue when it's at like really, really high levels, when it's almost like at an extremely high level is when it's when people are starting to see these health impacts. Then they're also doing animal studies, atrazine and uranium. So there are MCLs for both of these. The data is more limited on these two contaminants. Potentially for atrazine, there's some reproductive impacts. So low birth weight, preterm deliveries, etc. It's unknown. Data or research still being done. Atrazine is often found in surface water, which we have in Nebraska, but like I was saying, we have groundwater. We rely on groundwater a lot more. And that's not to say atrazine can't get into groundwater, but it's more commonly found in surface water. Animal studies being done. Uranium, that is also a common contaminant that people talk about or ask about. We see kidney damage is the most consistently found health impact. There's more research still being done, animal studies being conducted. So manganese, iron, fluoride, and radon. So none of these have an EPA maximum contaminant level. So none of these are regulated by the EPA, but they do have something that's called secondary contaminant level, which is like a recommended. EPA doesn't require it, but it's like recommended to keep your water a certain way. So it's a suggested limit, but it's not required. The data is limited. Potentially there are associations with different impacts, like nervous system impacts or fertility. These different kind of contaminants can make the water look different or smell different or kind of taste different. But there are no EPA standards required to follow for these contaminants. Fluoride, a little bit of fluoride we know is okay, but excessive and long-term exposure can potentially be harmful for us. So what can we do to address our exposure? So I know giving this talk, it can be kind of like, whoa, what's in my water? It's overwhelming. A lot of stuff. But there are things that you can currently do right now. So the number one thing that we recommend is you need to know what's in your water before you can really do anything about it. So you have to get it tested. You can test it for whatever you really want to. So you can test it for nitrate, bacteria, any other suspected contaminants that you may have heard like your neighbors testing for or something like that. It's important to note that nitrate has no odor, taste, or appearance. So you really won't know that nitrate is in your water unless you test for it. And there are different kinds of testing. There are dip strip tests, which is like you literally just get like a cup of water and it's a strip and you just test it in, you dip it in, and then it will like show a scale of colors. Like a really high color will be like pink, and then like, like it's on a scale of colors. But then there's more sophisticated tests as well that you work with a certified lab to figure out your nitrate level. So if your nitrate is high, what we often recommend is putting in a reverse osmosis system. So that can be whole house wide or just a point of use. So if you specifically drink out of like a certain faucet next to your sink, you could put your reverse osmosis system on that and use that for your drinking water. There's a different ion exchange system that's a more expensive system, or finding an alternative drinking source. So if you're just decide you're going to drink from bottled water, or maybe you can hook onto your neighbor's well or something like that. Things that do not remove nitrate. So sometimes I get asked, can I just use a filter in my fridge or a Brita filter or something like that to remove nitrate? And the answer is no, that does not remove nitrate. Also, boiling water does not remove nitrate. It really only concentrates it. So do not boil your water to remove nitrate. So, so the reverse osmosis system, as I just mentioned, there is some current funding for it. If you are unaware, there's a rebate program that goes along with it. I can answer more questions if people are interested. I guess I'm not going to go into a bunch of detail right now about it, but pretty much if you test your water and it's high in nitrate, the state currently has some funding to help you out with putting a reverse osmosis system if you live and drink from a private well. It doesn't work if you live in the city and you're wanting to get one and you drink from a community public water system. But if you have a private water system, you're interested in getting a reverse osmosis system, potentially the state can help reimburse you and cover some of that cost. Okay, I think that is it. I do want to mention too, we have a lot of resources so online. So like where can you order a kit, like a testing kit and like all that kind of stuff. We have on the UNL water website, and I can put the link to that in this chat. There are like all the like so many resources of like where to order the test kits, where do I send them, like all that kind of stuff. That I can offer to you guys too. But that's what I have as like a formal presentation. But yeah, I'll take any questions or continue this discussion and however. Thanks.
Yeah, if you have any questions, I see someone here posted in the chat. Is there any assurance that bottled water is not high in any of these contaminants? Are there standards that bottled water must also meet?
Yeah, so that's a good question. People often assume that bottled water is a lot cleaner than other water. To my knowledge, bottled water has to follow like the EPA. So like it has to be below like the 10 parts per million. It has to be below all of the EPA required limits. But that's not to say that it's like completely crystal clean, like some of them advertise that they are. It just has to meet the minimum EPA requirements. So potentially like the water you're drinking at home could be less than 10 parts per million, but the water in the bottled water is just barely meeting the 10 parts per million. So there really is like no, like it's kind of false advertising that it's like spring water or something like that. Potentially. It doesn't have to be super crystal clean.
Real quick, if you still have questions, please put them in the chat, or you can also, yeah, just put them in the chat. Sorry, you can't you can't unmute yourself. But we do have the poll before you leave. If you can fill it out, we would greatly appreciate it because it would help us make better events and how things we can improve. I don't think I see anything in the chat. I guess I did have one question. I guess it was kind of related to bottled water, but are PFAS, is that something that is regulated at the moment? I can't recall if that was.
No, it's not currently regulated. The EPA just proposed like a rule, and then the states have like time for comment. So it pretty much is going to be probably like really high likely chance that it will be regulated soon. But right now there's no regulation.
We had another question, a few actually coming in right now. Are plastic bottles an issue? I would assume the ones you can buy at the store that are like, the $1 bottles, but also maybe the reusable ones that a lot of people have.
Like an issue for being
Probably the contaminants. I would assume like PFAS and also those PBA, PBB plastics.
yeah, I mean, I guess I don't know the PFAS level, or that how that's impacting them. But or impacting the water through the bottled water. But yeah, I guess we don't really know. I guess as for like different kinds of bottled water and what's in them, I'm not sure like if websites like have them on their web if companies have them on their website or something like that of like rules they abide by or like levels they abide by. But yeah, that right now I think they just all follow the EPA limits.
Um, I think you might have mentioned it, but we have a question. Where do PFAS come from? I believe you mentioned like nonstick pans and things like that.
Yeah, so PFAS were actually it was something that's been developed to like be like so something that's like grease resistant, oil resistant, non-stick, like this chemical that's like resistant to everything. So like it's in firefighting foam to make it like last, like it's not going to be easily like it's not going to easily like decompose or something. So it's been created to be this like that's why it's nicknamed the forever chemical because it's been created to like endure a lot. So it's used on like if you use a nonstick pan, or if you have like I don't know, different things that are different pieces of clothing or something like that that are like oil resistant or like couch that's like stain resistant, stuff like that. Um, Typically like PFAS is used for those. But again, I do want to emphasize I don't want to scare people, but it because we all have probably been exposed to them at some level. It's really when you're exposed to like really high levels for a prolonged amount of time.
We had a question. What about chlorine? Water seems to taste different in the bottles as it ages. And yeah, we'll just answer those two.
So chlorine is typically used to treat water. Water seems to taste different in bottle as it ages. How does a person find a water filtration system? Um, I'm not sure how to answer the water seems to taste different in the bottle as it ages. But as for chlorine, I don't know for sure if there's like a certain limit. I'm assuming there is, but I know like cities often use chlorine or like a lot of it to treat their water, to treat it from other contaminants. So it can have a pretty strong taste that a lot of people don't like. Um, the water that seems to taste different in bottles that ages, I'm not really sure the answer to that. And I would answer like, how does a person find a water filtration system? Um, Probably I would say like do some research. You can ask maybe what a friend's using, or if you know of someone that's using something. Um, or if you want to go to a professional, like go to a like Culligan or something like that and ask them, talk to them about your issues, and what's the best option for you. It doesn't have to, a reverse osmosis system doesn't have to be super expensive. If you install it and stuff yourself, it can be like a couple $100. There is some upkeep, but I see Michael's Hey, great talk. Do you think that further data? I'm not sure about the do you think okay, so this question was, do you think that with further data on nitrate, will you see a push to lower the nitrate MCL? I'm not sure. I think like it depends on what the data shows, but if we would lower the MCL, there would be a lot of because also nitrogen is naturally occurring. Um, so there would have to be a lot of I don't know. It would be a big deal, especially like let's say you lower it to like 5 parts per million or something like that. Like it's a lot for cities to have to pay for that. It's expensive. It's already naturally occurring in some places. So there would I'm not sure. It depends on like how strong the data is. And then I also think like how um ready or like I guess the government or like assistance would be how readily that would be provided for people.
Yeah, and I think MCL stands for like maximum contaminant level. So I think that would be the level once it reaches that, then the city or whoever the utilities will have their action level thing they got to do to lower that.
Yeah, yeah. I know people are talking about like lowering the nitrate MCL maximum contaminant level because of the data, but I don't think it's going to be strong enough for a while if that does happen.
We got a answer here in the chat. It does seem that chlorine in the residual public water is 4 parts per million, and that bottled water is regulated by the U.S. Food and Drug Administration. So that would make sense too.
Yeah.
Well, it doesn't seem like we have any more questions. Again, if you haven't filled out that poll, please fill that out. If not, thank you again for attending our event, and thank you, Laura, for giving us all the information. If you don't have if no one has any more questions, thank you again. We'll post this on YouTube, and yeah, you can get more information from that too as well.